The Ministry of Women, Children and Social Welfare, in partnership with the UNFPA, today presents the State of the World Population Report and also launched the National Gender-Based Violence Helpline. The State of the World is UNFPA's flagship report, which seeks to the current position of global efforts on population issues, especially the needs, issues, and current conditions of the youths, girls, and women globally.
Today, the 30th of June, 2020, is a very important day for UNFPA globally as we launch our annual flagship State of the World Population Report. The State of the World Population Report showcases normally population trends, as well as highlight factors affecting the well-being of the world's population, especially women, children, and young people. It calls for action to address the challenges facing this population. This year, the theme of the State of the World Population Report is Against My Will, defying the practice that harm women and girls and undermine equality.
The theme for this year's report, Against My Will, defying the practices that harm women and girls and undermine equality, focus on the three most prevalent harmful practices: female genital mutilation, child marriage, and extreme bias against daughters in favor of sons.
The system in the Gambia developed specific and practical guidelines to assist the country in addressing the very real challenges facing the most vulnerable and marginalized people in society. This complements the government's national structure and ensures synergy with the context of the challenges identified and emanating from the impact of the COVID-19. Today's launch of the helpline geared towards mitigating the risks and addressing the issues of gender-based violence in the Gambia in an integral part of the MPTF project and cannot come at a better time in the Gambia as we witness rising cases of COVID-19 in these months. Integrated gender-based violence, case management, and psychosocial support systems to prevent and respond to GBV during COVID-19 will enhance capacity, access to hotline services, to provide psychosocial first aid services to women, girls, boys, men, persons with disabilities, and the elderly, to get relief from the shock, stress, and fear from immediate effects of COVID-19 and GBV causes.
The hotline, which will be implemented by Paradise Foundation, will serve as a professional counsel unit and provide psychosocial support to victims of GBV.
In the Gambia, the government of His Excellency President Adama Barrow and my ministry are working tirelessly to ensure the eradication of harmful practices that hold our women and girls back and impede their growth and development. The enactment of legislation prohibiting child marriage and FGM and other forms of GBV are highest in our priorities, and today we launched the National GBV Helpline, a solid tool that will help the government and its stakeholders in its efforts to combat gender-based violence and support survivors.
The event was launched by the First Lady Fatou Barrow, who expressed the continued support of her office in the fight against GBV.
I wish to thank all women and girls who have sometimes defied their cultural norms to campaign against harmful traditional practices. We all have to muster the courage to stand for the welfare of women and girls in this country. Continue to stand for what is right. With time, we will win. I wish to assure you all that the Office of the First Lady will provide all the support necessary for the realization of this great initiative and other GBV programs in the country. On that note, I declare the National Gender-Based Violence Helpline and 2020 State of Population Report officially launched. I thank you all.
fight against gender-based violence and gender discrimination still continues globally, especially during the coronavirus pandemic. The Helpline has now been launched, which will serve as a professional counseling unit and also provide psychosocial support to victims of GBV. The hotline to call is 1313. Reporting for the Fatu Network News Review, I am Jaka Sisijete.